After exposure, you can still achieve immunizations depending on the disease. So for example, if the patient has been exposed to measles and is greater than 12 months of age, you can give the vaccine within 72 hours of exposure, and you may be able to prevent them getting the disease. If the child is between 6 and 12 months of age, it is recommended that this child has been exposed to measles receive immunoglobulin. Also, if the woman is pregnant and or immunocompromised patients, they should receive immunoglobulin, not the vaccine, because the pregnant woman is already at risk. So you will give them immune globulin. Now, don't forget, when you give immune globulin, you must wait 3 months before giving any live virus vaccine. If the baby is less than 6 months of age and is exposed to measles, there's no treatment. You just wait unless the mother is not immune. Usually, if the mom has been immune because she's received her vaccines, then the baby will have transplacental transfer of antibodies and have immunity for at least those first 6 months. The varicella vaccine, it should be given within 3 days of appearance of the rash in the index case. It should be given to patients who are immunocompromised and also to the household contacts, and that will help prevent the disease. Also, varicella zoster immune globulin should be given. Now, you can give the immune globulin and the vaccine simultaneously at separate sites. Varicella zoster immune globulin is also indicated for susceptible pregnant women, and as we discussed in the very first chapter, newborns whose mothers break out with varicella, then those babies can also receive VZIG. A lot of questions that can ask you on who could get what. The mumps and rubella generally is not protective, but it still is recommended to in exposed adults who were born after 1957. I suspect that's most of you taking the exam. Most people that are taking the exam have been born after 1957 and should have a second MMR vaccine anyway.